And
if you can
just
enlarge
checking
your
if you can
if you can
all see
enlarge your
that.
presentation, Mark, that would be even better. Yeah, perfect. That's
Yeah.
great.
Okay, so maybe just a little bit to start about Intermountain, and Peter did a very good job of describing us. But we are a mixed medical model, so we work with both affiliated physicians in our clinical networks, and we employ physicians across 3 states of Idaho, Utah, and Nevada, which you can see kind of right there in the middle. 40,000 caregivers, 24 hospitals, and about 2,900 beds. And what I think is important for this group to know is that, yes, we have a large tertiary quaternary medical center in Salt Lake City, Utah. We also have multiple critical access hospitals because most of the West, the interior West of the United States is rural. And we're proud of the fact that Utah is only one of 4 states of the United States that has not had a rural hospital close in the last decade. And we feel that both our work with rural healthcare as well as our partnership with other rural facilities is part of what makes that happen. We actually, while we have 210 clinics, our telehealth programs spread well across the interior West, in fact, all the way to Alaska with a pediatric cardiology telehealth service. And as Peter mentioned, part of Intermountain Healthcare is Select Health, which is a wholly owned subsidiary. It insures over 910,000 members in Utah and Idaho and Nevada, and is actually really the growth arm for value-based healthcare for us. Our mission is helping people live the healthiest lives possible. Our vision is to be a model health system by providing extraordinary care and superior service at an affordable level. And I got to tell you, when you walk around Intermountain Healthcare, every one of us lives and breathes and just is totally committed to this common purpose, to this mission and vision. We talk about our values of integrity, trust, excellence, accountability, mutual respect, and equity. And we focus our work across the fundamentals of extraordinary care. And these fundamentals for us, in order of importance, are, while all being important, but it starts with safety, quality, experience, equity, access, stewardship, all happening in the context of engaged and empowered caregivers. So back in 2017, after 40 plus years of being a hospital-centered, regionally managed healthcare system across Utah, we sat down as a leadership team and asked ourselves a simple question: how do we care for people today and into the future? And what we realized is that the answer was actually pretty simple, although it took us a long time to get to that answer. The first thing we do is we keep people healthy. I think this is very much aligned with what all of you have been talking about today. The second thing we do is that when people get sick or injured, we help them get back to being healthy. So we have population health type of care, and we have episodic care. And so we reorganize, and I'm sure all of you have been through reorganizations. That is also challenging, but boy, it's the right thing to do, and you step into it with courage, and because it's the right thing, absolutely. And so we are now reorganized around those 2 concepts. So half of our organization is focused on keeping people healthy, the other half on helping them when they're sick. One group thinks about what are our outcomes on a per month, per year basis across multiple specialties. The other group is thinking about cost per episode and outcomes per episode. And that has set up this healthy and intentional tension and discussion, because when one part of our company is about keeping people out of the hospital, the other part of our company is saying, hey, we need our hospitals to be busy and full. And that leads to great discussions, great innovations, and growth. Our strategies going forward are listed here. So we are all in on population health and value. We believe that we have done several things in recent years to make this possible. We have stood up a independent company, wholly owned subsidiary company called Castell, which brings population health services not only to our employed physicians, but every practice in our clinical network. So we support these practices with care management, with what we call care traffic control, which is guidance through healthcare systems, social work, and behavioral health access. All of you know the strong link between behavioral health and our health overall. We started a not-for-profit drug company called Civica RX. Yes, we don't have control of drug prices, but we also would not stand by with what was happening with generics. And so we now have over 40% of all hospitals in the United States are part of Civica. Interestingly, I always throw precision genomics into population health. So we are in the middle of a study to map the genomes of 500,000 people, making it the largest genomic registry that we're aware of. And we believe that there is a great intersection between a person's genes, a person's behavior choices, as well as what's going on with them clinically, and we're going to bring all that together. Peter, I'll just share one other thing that's on this list, because I think a lot of this is self-explanatory, but in the bottom left, you see Select Health Share. This is a program that aligns our health insurance company, employers, and our clinical network, and then individuals. And we, each of those four makes commitments. We share in our commitments to improving either individual health or the health of a group or the health of a community. And through Select Health Share, and this is a little bit of a nod to Mr. Miller's presentation, we are now able to guarantee to businesses that we will not increase their health insurance by more than 2% per year, because we've been able to bend the curve, bend the increase in spending, and not only spending, but in total costs on a per member per year basis. And so instead of going up like this, it goes up very, very small. And it gives businesses predictability for their cost structure, and that makes them more competitive. And then they grow, and then they employ more people, and our communities get healthy. And so it really is a full community view to health and wellness. Our latest fundamental that was added this year is equity. I'm sure all of you are aware of the social unrest and the outrage shared by us based on the murders of George Floyd and Ahmaud Arbery, Breonna Taylor, and others. We had always talked about equity when, if you took a course by Dr. Brent James and the Healthcare Delivery Institute, you would hear him speak of equity going back to the early 90s. But we felt that we had to bring this forward. And so we are applying everything we've learned in actually delivering outcomes in value-based healthcare to now addressing the issues of equity and healthcare disparities. We know that it's not just a healthcare issue, it starts in the community, so we will align public policy and advocate. Our caregivers must reflect the diversity of our communities, and so we will be intentional about how we grow our clinical teams so that every aspect of diversity is represented in our healthcare workforce. And we will absolutely evaluate over 80 issues or healthcare outcomes in clinical care and assess them for disparities, and then act and develop 20 interventions that will make a difference, and that will happen in the coming year. So as we look ahead, we know a couple of things. Well, we think we know a couple of things. We believe healthcare is going to be safer and better. It's going to be more digitally enabled. People are going to have increasingly amazing experiences, and people will be empowered to do self-care as they interact with their general practitioners and their healthcare systems. Again, the projects that we saw earlier speak to that. We also know that healthcare must be and will be more affordable in the future. What isn't always known is who's going to do that. We believe in acting before you have to, acting from a position of strength, acting when you can make the biggest difference, and you have our commitment to continue to do that. The people on the screen here just really reflect where this all happens. It's our caregivers, it's our local leaders, it's our operating model that enables us to prioritize initiatives, develop key performance indicators that then get cascaded across 3 states and 40,000 people. It's that operating model's idea system that allows us to implement over 40,000 of our caregivers' ideas every year. It really comes down to people. And so I'm inspired by what I've heard today from all of you. I share your passion, I and 40,000 others. And again, I'm so thankful for the recognition today and the honor that you've bestowed. And I promise we're going to keep moving forward as fast as we can. So thank you all very much.
Thank you so much, Mark Briesacher, for sharing this with us. I think your Intermountain is certainly one of the front runners, both in the USA but all around the world, in your initiative. It's really inspiring, and you are an inspiring speaker to explain how Intermountain is taking care of the population in your 3 states.